Hello everyone, I'm Dr. Sudha, your own consultant cosmetic dermatologist on Mission Beauty Sundari Honaras. Well, we have come at the most wonderful topic today. Definitely you want to know? Yes, many of all suffer from dandruff and then that dandruff falls on your hair and you feel like scratching your scalp, isn't it? So here we have come up with a wonderful secret unfolding about dandruff, and we have Dr. Monalisa joining us from Kerala, from Thrissur. She is my student and I'm very proud to tell you that. And let me tell you, she is a wonderful Instagrammer. So she gives various tips in relation to beauty. So if you want to really know simple quick tips, you can follow her on Instagram. So here with I present Dr. Monalisa, who has completed her MD from MIMSR Latu with wonderful grades. And since last 1 year, she's into a private practice. So welcome Dr. Monalisa on this platform of Mission Beauty.
Hi ma'am. So I'm Dr. Monalisa. I'm working currently in Kerala as consultant dermatologist in a clinic in Thrissur. I've been practicing since almost 10 months. I was ma'am's student. I passed out my MD last year. So I'm very happy to be here and to give some insights on dandruff.
Wonderful. Let's begin with the secret unfolding, Dr. Monalisa. Yes, tell our women that what exactly is dandruff?
So dandruff is a very common, problem which we face. Not only women, even men. Men or children, they face this problem. It is due to increased flakiness of your skin, of your scalp. It can occur due to multiple reasons, but the most distressing symptom of dandruff can be itching, which can be mild to severe. Even some patients also complain of, little bit of increased hair loss. And if this dandruff remains for a longer duration, it can be, socially, it can impact the patient socially. It can cause depression, low self-esteem, because whenever they touch their hair, the flakes fall over their clothes, over their face, and that is very visible, evidently visible. So it's a very distressing problem which is commonly encountered by patients.
And it's very, very common. I think so each one of us see every day in our clinic. This is one of the commonest problem that people come to us. No wonder we are here to discuss. And really we want to share the wonderful tips of knowledge with all our Mission Beauty women, men, whoever wants to join there. Yes. Dr. Monalisa, can you tell us which are the areas which get affected with dandruff?
Yeah, so the commonly affected area is always the scalp, but this dandruff can occur over any hairy area, including your beard, your eyebrow. It can even occur in your genitals, your axilla. It can occur behind your ears. It can occur at the side of your nose. So these are all the commonly affected sites, but basically the most commonly affected site is the scalp.
Yes. Why do we have dandruff, Dr. Monalisa?
So there are various causes for this dandruff. So I'll just tell in brief. So normally when our skin, there are layers of our skin. So when the lowermost layer, replenishes and comes above, it takes at least 1 month for this whole process to occur. But in dandruff, this cycle is, fastened, it is increased. So this occurs in 2 to 7 days only. So therefore there is more accumulation of dead skin cells over our scalp. So hence, that leads to flakiness and increase in dandruff. Second reason could be because the patient can normally only have a dry scalp, like a dry skin, even a dry scalp can occur, which leads to increased flakiness. Thirdly, it could be due to increased oil production from our scalp known as sebum. So if there is increased oil, means there can be increase in dandruff, because dandruff can be caused by a fungus called as Monalisa, which thrives on this sebum and oil. So if in an oily scalp, it is more prone to dandruff.
Wonderful. So there are basically what you said was it could be due to dry scalp, it could be due to excess production of oil, or it could be simply increase in the turnover of the skin cells. That's wonderful. What is psoriasis? Many people, think that whenever they have dandruff, they are doubting. Doctor, do I have psoriasis? So what is psoriasis of scalp?
Okay, so now this dandruff is an umbrella term. Okay, it is just an umbrella term which has many types. Okay, it is used by a layman, dandruff. So when you talk about psoriasis, is one type which comes under this dandruff. Okay, so psoriasis is an inflammatory condition which presents with red patches over your skin with flaky lesions with silver color scales, thick silver color scales. It can also present on your scalp along with your elbows, your knees, all the joint areas, your lower back, like that. So psoriasis requires an entirely different treatment from dandruff, but consulting a dermatologist for the same, knowing the cause, it be more appropriate.
Yes, many times it so happens that it is okay. Just thinking it's dandruff.
Yeah.
So look into the patch, and it could be invariably psoriasis. So for that, definitely you need a consultation from a dermatologist, because a dermatologist will be able to differentiate a dandruff and psoriasis.
Yeah. Yes.
Do that. So if it's not going away, if your dandruff is not going away, please consult a dermatologist is my earnest request to you. Can you tell us, Dr. Monalisa, what are the different types of dandruff that we see?
Yeah, so like I said, dandruff is an umbrella term. It has many types. One can be simply dry scalp. One can be a condition known as seborrheic dermatitis, which occurs due to increase in a fungus called as Malassezia. Now, this Malassezia is normally present in our skin, but due to excessively oily scalp and sebum, it can, multiply. So in this condition like seborrheic dermatitis, this Malassezia can increase to 2 folds. So this is the second condition. Third condition can be psoriasis, which is obviously an inflammatory condition affecting the scalp. So you can see red patches with silver color scales and very itchy lesions. Fourth can also occur due to another fungal infection called as Tinea capitis. So this is a fungal infection which presents as patchy lesions over the scalp, patchy areas, which can be extremely itchy, and it can occur most commonly in children. So getting it diagnosed from a dermatologist is utmost important, because the dandruff can have many presentation, can have many types. Getting the correct diagnosis is very important for the correct treatment.
Very well said, Dr. Monalisa. I mean, I really appreciate it, because many a times people just don't bother. Okay, I have dandruff, that's all. But they don't know what is the reason for the dandruff. See, until you know the reason, then you will not be able to treat it well.
Yeah.
Now let's move on to the treatment. Definitely people would like to know from you, what are the shampoo that should be used, how it should be used, how often should be used. I mean, can you just give us wonderful tips in regards to this, Dr. Mona?
Yeah, so supposedly you're diagnosed with a condition called as seborrheic dermatitis, then your shampoo should contain ingredients like ketoconazole, zinc pyrithione, selenium sulfide, cyclopyrox, or salicylic acid. But if your diagnosed condition is psoriasis, then your shampoo should contain ingredients like salicylic acid and, more importantly, coal tar. If you're diagnosed with a condition called as plain dry scalp, which is leading to itching, then you can look for ingredients like salicylic acid or aloe vera, coconut oil, argan oil, all these moisturizing ingredients. And when you ask how to apply the shampoo, if you have severe dandruff, then you can start by application of the shampoo every alternate day for 2 weeks. Then by decreasing the dose to twice weekly for again 2 weeks, and then you can come down to once weekly for another 2 weeks. But the important part here is you must keep the shampoo for at least 5 minutes. You should not be immediately washing it off, because if you immediately wash off, it makes no difference. It doesn't have any action on the fungus. So keeping it for 5 minutes is recommended for at most results.
Wonderful. So basically, as Dr. Mona has said, I mean, it's different shampoo for different conditions. So again, primarily you need to consult a dermatologist to give a correct diagnosis and the right shampoo. Yes. The next question, definitely, we are in an Indian scenario, and as you belong to Kerala, oiling is one of the part and parcel of our Indian custom. So what are the tips you would like to give in regards to oiling, Dr. Monalisa?
So normally patients feel, that if they see some flakiness over their scalp, they just dab some oil and that kind of just makes the dandruff stick together, and it kind of masks the effect, and it shows like, oh, the dandruff is gone. But actually that oil, it increases the dandruff. You know how? By, if you apply excessive oil, it leads to a sticky scalp. So the dirt and all this thing from the atmosphere, it can settle down in your scalp, it can clog pores, it can increase the greasiness, and ultimately worsen the dandruff. Okay, and like I said earlier, when you provide more oil in the scalp, you're providing the fungus more food. So if the fungus can grow, and therefore it can even worsen the dandruff. So if you want to really apply oil, the recommended tip is that you can apply it for 1 hour before hair wash and just remove it off with a shampoo. You cannot apply oil after your hair wash. You cannot keep your oil for the whole day or for overnight. So if you want to really apply oil, 1 hour prior to hair wash and washing it off with a shampoo is good.
Wonderful. Very simple tip. You want to oil your hair, just 1 hour prior to your shampoo, apply the oil and then shampoo it. That is a great tip. And don't keep it all through the day, or don't keep it overnight. Yes. Is there any special diet that our people could follow so that they can keep themselves away from dandruff, Dr. Monalisa?
So a well-balanced diet is recommended for such condition. Now, dandruff can occur due to mild inflammation. So we need to have food which can decrease the inflammation. Okay, so that could be some healthy fatty acids or probiotics. Or when you talk about fatty acids, the main common fatty acid is omega-3 fatty acid, which you can find in fish like mackerel, salmon, or in vegetarian diet like flax seeds or walnuts. You need to also have plenty of green leafy vegetables and colorful fruits, because these keep your vitamins in control, in check, and can even help in hair growth.
Yes, I think so. Adding a bit of vitamin A also can correct the skin. Yeah. Orange colored food stuffs, like you can eat papaya. You can. So I would just recommend in a day at least enjoy one fruit, and you eat a little bit of walnuts every day, walnuts, and flax seeds after your breakfast. So these are simple tips which you can inculcate in day to day. So omega-3 fatty acids not only works for your dandruff, it works for your beautiful skin as well. Yeah, so just keep on adding a rainbow diet, as I say, colorful diet.
Colorful diet.
Colorful doesn't mean that you are going to add artificial colors. It is going to be the real greens, the leafy vegetables, and the reds like a pomegranate, and the yellows and the oranges like papaya, and the lemons, vitamin C. So all kinds of such wholesome diet if you enjoy. Definitely you will have a beautiful skin, hair, and Dr. Monalisa is a live example telling you that this is how you need to take care of yourself if you want to have healthy hair, because she is whatever she talks, and it's like walk the talk. So you can see her as the best dermatologist. She definitely is following those tips for herself. No wonder she has a flawless skin. She has lovely hair. So this is how the dermatologist is doing this whole regimen, and this is the experience which she's speaking. Now, women who are in the middle age wouldn't like to follow my footsteps, definitely, Dr. Mona. They would love to color their hair. They want to perm their hair. They want to, do a straightening treatment. They want to do keratin treatment. So what is your advice in relation to dandruff?
Yeah, so when you talk about these treatments, they are mostly done on the length of the hair. Okay, the treatment targets the length of the hair and doesn't target the scalp. So of course you can go ahead with such treatments, but you must not even overdo it, because it can lead to product buildup over your hair and scalp, which can be cause more itchiness of the scalp. But yeah, you can go ahead with these treatments.
Wonderful. So it was such wonderful tips that we received. Can you just sum up as a take-home back message for all these women on Mission Beauty platform? What are the simple take-home back messages that you would like to give, Dr. Monalisa?
So my take-home message would be that in India, many people consider dandruff occurring due to poor hygiene. So that is a very big myth that we need to bust, because it is not because of poor hygiene, but it can be more visible if your hair wash day is delayed. Okay, to the next hair wash day, your dandruff is more evident, it is more visible, but that does not mean it occurs due to poor hygiene. So, and identifying the cause of the dandruff is very, very important. There are many, false marketing going on in the TV or in the social media that, just use this shampoo, just use that shampoo and your dandruff is gone. But that's not how it is. There is a doctor for the same, there is a dermatologist for this condition. So you need to visit a dermatologist, get the cause diagnosed, and ultimately take that appropriate treatment. Just avoid taking OTC medications because it's just going to do more harm than good, and the effect will be only temporary.
Wonderful. As Dr. Monalisa has said, there are a variety of plethora of shampoos. And there's one important thing I would like to tell is dandruff never goes away. So, you have to keep it under constant check. So, as if you have once you're diagnosed as diabetes, definitely this is the same. So, you need to take a regular care. And if you don't do that, definitely you are going to lose your hair. So, if you want your hair to look healthy and wonderful, keep on check with the dandruff and just visit a dermatologist. Now, at the session of this wonderful tips from Dr. Monalisa, definitely we would not like to end this session, but I promise you on Mission Beauty that we will come Facebook Live and YouTube Live. So keep all your questions ready and just fire it on Dr. Monalisa and she will answer you all those questions in regards to dandruff. If there are any more things you would like, definitely give us on the comment box. And other women above 30, you can join our Facebook group link, which we'll be giving below. We will also give contact number and Instagram of Dr. Monalisa. You can just follow her and you can always call her and ask all the online tips that you could follow for yourself so that you keep looking fabulous, healthy, beautiful, glowing skin and a lovely, healthy scalp. As we end this session, Dr. Monalisa, my last question to you is, what do you think about Mission Beauty and Dr. Smita? Can you give a passing remark on this?
Yes, actually now Mission Beauty, I have known since like past 1.5 years, like since I was a PG student, and I can say it's a wonderful initiative because women are, targeted for, aging faster, losing their beauty with age and everything. And people target women so easily, like in this society. So making women feel good about themselves is one of the most beautiful things that you can do. So ma'am, you're actually doing a great job and I have seen your journey all this while and it is just improved with time. So, and I'm very grateful to be part of this journey and I'm looking forward to more videos like this.
Wonderful. So in Mission Beauty Sundarmi Honara, next 3 years, I would like to make 1 lakh women beautiful. And this is not possible without some wonderful dermatologists like you who are sharing the knowledge. And this platform is for all of us. It's for the women, by the women, and especially a women's platform for their beauty. And I believe that every woman is uniquely beautiful and she has to live her life in a very beautiful way. Thank you so much, Monalisa, for joining us on this platform from Kerala. And definitely stay in touch because our women have many more questions which they are going to fire on you when we come live. So thank you so much.
Thank you, ma'am.